Well, good morning. I hope you're doing well as we have made it into the first few days of pharmacology. And today we are going to look at the simple concentration calculation and how to figure out what a simple concentration of a vial or an ampule or a capsule of medicine would be. Hopefully, this is not the way you feel about me right now. And so, hopefully, you haven't got the sights on me quite yet. And so, we'll see if we can't knock out simple concentration, and things will slowly begin to fall into place. So, let's get started. Well, all right, let's talk about simple concentration. Now, we have so far dealt with weight conversion, we have dealt with unit conversion, we have dealt with how to figure up the total amount of drugs needed when you're told to give a certain amount of drug per kilogram. And then the last thing we looked at was fluid calculations, how to figure up how to give a certain amount of fluid in a certain amount of time, no matter if that fluid is saline or whether that fluid had medication in it. That when you were told to give a certain amount of fluid over a certain amount of time, we simply used a straight fluid calculation. So today in this series, we want to look at the next important step, which is how to figure out what a simple concentration is. Now, there's a lot of different definitions, or depending on which field of healthcare you're in, they may teach you a little bit different terminology for this. But we call this simple concentration, and that simply means how much drug in milligrams or occasionally micrograms, depending on what it is, do I have over 1 milliliter. So basically what we're going to do is we're going to take the vial of medicine. And on the vial of medicine, it will tell us something as this is a 10 milliliter vial. And it will tell us that we have 250 milligrams in that vial. What I want to know is what the simple concentration is. So I want to know how much medicine in milligrams do I have in every 1 milliliter of that fluid. So to figure this out, it's extremely simple. I would take the amount of drug I have in the whole vial, and I would divide it over the amount of fluid I have in the whole vial. I would divide it by. Well, when you say 10 into 250, you come out with 25 milligrams per every milliliter of fluid. So I know that every milliliter I draw up in a syringe, I'm going to have 25 milligrams. Now that's going to be extremely important for our next step that we'll learn about in the next section, which is basically how to figure out how much drug to pull up in a syringe. But I have to know this first, so this is the next crucial step. Now I can use this when I'm using an ampule of medicine. I can use this when I'm using a vial of medicine. Typical spelling errors for Mr. Sessoms. I can use this when I am using a pre-filled syringe, such as a Capujet. I can also use it when I am using a bag of fluid. And we'll talk about that and give you an example of that in just a minute. But we're trying to find out how much medicine do I have, and typically we want this in milligrams. I'll give you a couple examples where it's better sometimes to put the simple concentration in mics. And we want to know how much is in 1 milliliter of fluid. So let's do a little bit of practice, and then you'll see how that works out. So I am giving a vial of fluid, and that vial of medicine that they give me contains 250 milligrams of medicine. Okay? And they give me the vial, and the vial has 30 milliliters of fluid with it. So here's my vial they hand me, and on that vial it would say there are 250 milligrams in total in the vial, and it would tell me that it is a 30 milliliter vial. And I need to know what is the simple concentration. All you do is take the amount of drug, place it over the amount of fluid that it's in, and divide that out. Now, both of these numbers have zeros on the end, so I know I could knock that zero off due to some math shortcuts. 3 goes into 25 8 times, and we always want to go out to the first decimal place. And so when you say 25 divided by 3, you'll see that goes 8, 24. You got 1 left over, drop a 0. Remember that your decimal is there. 3 goes into 10 3 times. That's a 9. Drop a 1. Here's another 0. It goes into that 10 3 times. So we're going to round that up to 8.3. And the units are always crucial. You'll miss this on a test if you don't put the units. 8.3 milligrams per milliliter. So every milliliter I draw up, I'm going to have 8.3 milligrams in it. See, that's extremely simple, isn't it? Let's do a few, and let me write some here and let you pause, and then we'll show you how these work out. So let's say, and I'm going to use some real vials that I have sitting here in front of me. I have 400 milligrams, and it appears to be in a 10 milliliter vial. That's dopamine. And then let's use this one here, which we've already done aminophylline. Let's use my Narcan. It has 400 milligrams in a 10 milliliter vial. We've already done Narcan. Let's do another one. Let's do Romazicon. Alright, Romazicon is in 5 milliliters. We have 2.5 milligrams. Alright. Then let's look at this one, which has 100 milligrams in 2 milliliters. That's thiamine. And let's just see here. Let's make up a few for practice. 1 gram in 10 milliliters. 2 grams in 5 milliliters. Let's put 500 milligrams in a 20 milliliter vial. Let's take a bag of, well, we'll do these first and then we'll come back to the bags. This one is 500 mics. This is digoxin in 2 milliliters. Alright, so let's work these out. So pause your screen and work them out, and then turn your screen back on or turn this video back on and see if you did well. Alright. Amount of drug over the amount of fluid. The zeros can go. 1 goes into 40. The answer to that would be 40 milligrams per milliliter. 2.5 in 5. You may have to write this one down here. Remember, the top number is the one that goes under the decimal place. So do 2.5 divided by 5, carry your decimal up. That's going to be 0.5. So the answer would be 0.5 milligrams per milliliter. 100 milligrams, 2 milliliters, equals 50 milligrams per milliliter. 1 gram, remember I said this needs to be in milligrams. 1 gram is 1,000 milligrams. And it's in 10 milliliters. So the simple concentration of that one is going to be 100 milligrams per milliliter. 2 grams is 2,000 milligrams in 5 milliliters of fluid. 5 goes into 24 times. So that would be 400 milligrams per milliliter. Then we have 500 milligrams in 20 milliliters. That would be 25 milligrams per milliliter. And then I gave you a crazy one here. Now, here's my question. Since we've told you that we're always supposed to try to get it in milligrams per milliliter with just a few exceptions, the question is, would you want to turn this into mics or into milligrams? Would you want to say 0.5? If you wanted to do that, that would be perfectly fine. You could simply say 5 point, because that turns into milligrams. You move your decimal 3 places. 1, 2, 3. So you could say 0.5 milligrams divided by 2 milliliters. Okay? And if you did that, you'd say here's 0.5, here's 2. It goes into that 2 times. That would be 4, drop a 0. So the answer would be 0.25 milligrams per milliliter. You could also just simply say 500 mics divided by 2 milliliters. You'd say, well, that's 250 mics, which is 0.25 milligrams per milliliter. If you were to put on a test that that's 500 mics per milliliter, or if you was to put on a test that's 250 mics per milliliter, I actually would not want that. I want you to put simple concentrations in milligrams over milliliters, and that's just one of the things that we kind of want you to do. So make sure you follow that format, except when I tell you the drugs that it's okay to do that with, and there are going to be a couple. So, boy, so this is really simple. This is really easy, and as I said, you can do this with vials, you can do this with ampules, you can do this with capujets, and you can do it with bags of fluid. For example, if I told you to draw up 1 gram of medicine, and I told you to put that 1 gram of medicine in a 250 milliliter bag of saline. Now, the first thing we would need to do is know how to draw that up out of the vial. So I would need to know how it was supplied. But we'll come back to that in the next section. Let's just say that I put 1 gram in a 250 milliliter bag of saline. I would ask you what the simple concentration of that bag is. Well, look, there is no difference between that ampule and then me putting it in a gigantic IV bag. All that means is it's a bigger type of bag or bigger type of ampule, but it's the same thing, okay? So, 1 gram is 1,000 milligrams placed inside a 250 milliliter bag. The simple concentration of that bag of fluid is 4 milligrams per milliliter. 25 goes into 100 4 times. So every time a milliliter of that fluid comes out of the bag, it has 4 milligrams of this medication in it. Well, now look, if I was to tell you you were doing a 60 drop set, how many drops would that be? Well, remember we talked about when you use a 60 drop set, every 60 drops is 1 milliliter. So every 60 drops is 4 milligrams because these two are equal. And I know that every time I drop a milliliter, I drop 4 milligrams. And every time I drop 60 drops, I drop that milliliter. So these equal up to that. If I were using a 10 drop set, well, it would be every 10 drops I would drop that amount of medication. Okay? So you see how these things are slowly starting to connect, I hope. Let's do another one of these bag questions. And then we're going to combine a few steps. So I told you that you need to place 800 milligrams, and I want you to put it in 1 liter of saline. And I want you to tell me what the simple concentration of that bag is. We take the amount of drug. I would take the amount of fluid, but I got to put it in milliliters. Those can go away. Those can go away. 8 divided by 10. Well, here's 10. 8's what I'm dividing into. 10 will go into 8 80 8 times. That's 80. So the answer is, in that bag of fluid, I have 0.8 milligrams per milliliter. Now, I've told you that there are occasions when this would be easier to do in mics. If you're using an infusion, which means you're using a bag of fluid and you have one that comes out to a decimal, it would be appropriate on a test for you to tell me that that bag of fluid is actually 800 micrograms per milliliter. And you'll see why when we start actually putting all of it finally together and you see how those medications pull in. Alright, so let's do a couple here. And let me show you how this all starts to play a role. So here is my bottle of fluid. This is my saline, this is my ampule of medication. And we are told that in that ampule there is 1 gram of medicine. And they want me to take that 1 gram of medicine and they want me to place it into a 50 milliliter bag. Okay, so I'm putting 1 gram out of this vial, which we'll come back to in the next section. I'm taking 1 gram and I'm placing it in that 50 milliliter bag of saline. All right, they want to know, first of all, what the simple concentration of that bag is. But then they tell me that they want me to give that medicine over 15 minutes. So basically what they're telling me is they want me to give 1 gram of medicine over 15 minutes, and they want me to use a 50 milliliter bag of fluid to do that. Because obviously I wouldn't want to push this drug out of a syringe over 15 minutes. That would take quite a while. So how do we figure that out? Well, let's not get confused first. Let's just figure out what the simple concentration of the bag is. So here it is. 1 gram, which is 1,000 milligrams, and I have placed it into a 50 milliliter bag. That means the simple concentration is going to be 20 milligrams per milliliter. Uh-oh, that wasn't good. There we go. 20 milligrams per milliliter. Now they tell me they want me to give the whole amount of medicine over 15 minutes, which means they want me to give this 50 milliliter bag over 15 minutes. It does not matter what this is on this type of calculation. This is not important right now. What's important is they're telling me they want me to give it all over 15 minutes. That's a fluid calculation. Remember, we just got through talking about that one in the last video. And so now, remember, fluid calculation is the amount of medicine, amount of fluid. And remember, that has to be in milliliters. And it is over the amount of time in minutes. And then we multiply that times our drop factor. So they tell me they want me to use a 60 drop set. Alright, well let's look at this. That would be 50 milliliters, that's the amount of fluid I got, over 15 minutes. And they want me to use a 60 drop set, which means every 60 drops I drop 1 milliliter of fluid. 15 goes into 15 once, 15 goes into 64. 4 times 50 means I need to start this running at 200 drops per minute. They also then tell me, hey, I want to know if I put that on the IV pump, what that's got to be ran at. Well, remember, we're using a 60 drop set, so on a 60 drop set, this answer is the same as the pump setting, except the pump setting is 200 milliliters per hour is what I would want to set the pump at. So this is a pretty simple type calculation. We do this quite a bit with a lot of our medications, where we tell you to take a certain amount of medicine out of a vial, put it into a certain size IV bag, and then the question tells you to give that whole amount of medicine over 15 minutes. Well, a lot of times students will get confused with this, and they'll think, well, that simple concentration of the bag is important. Well, it's not important for this type of calculation. In this calculation, all you need to know is that once you figure out how much to draw out of the bag, which we'll do in a little while, and we put it into the saline, how do I know how to give this amount of fluid over that amount of time? And that is by using a fluid calculation, which we dealt with already. I'm going to do one more, and then we're going to be done with this little section. Alright, so I'm going to tell you, I want you to place 2 grams of medicine out of a ampoule, and I want you to put it into a 250 milliliter fluid. And then I tell you that I want you to give it over 30 minutes, and I want you to use a 10-drop set. But then, after you figure that up, I want you to tell me what the pump setting for that would be. So cut off the video, take your piece of paper, figure this up, and then once you've got your answer, turn it back on. And let's see if you did right. Alright, first thing we need to do is we need to figure out what our simple concentration of our bag is. 2 grams is 2,000 milligrams. You're putting it in a 250 milliliter vial. Those go. 25 goes into 200 8 times. That'd be 8 milligrams per milliliter. That's what the simple concentration of the bag is. Not really important right this moment in this calculation, but it will be in a few minutes in another section. Then they tell me they want me to give this whole amount. So they want me to give all 2 grams over 30 minutes. And they want me to use this bag of fluid. Well, I know I need to take how much fluid I need to give. I need to put it over the amount of time in minutes. And they told me for some reason they want me to use a 10-drop set. Okay, well 10 drops is a milliliter. The milliliters go away. 10 goes into 10 once. 10 goes into 33. 3 will go into 250. 8. 3.3 drops per minute. That's using a 10-drop set. But then we've made it to the hospital and they want to put that on a pump and say they want to know what the setting is. Well, if you remember, we told you that this has to use a 60-drop set to be equal to a pump setting. Well, we used a 10, but if you remember from the last video, all we have to do is say that 10 times a 6 and you would get to 60. So all you have to do is say your number times 6. 83.3 would be, let me see here, 8, 9, 49, 1 decimal place. So I would need to set this at 499, or we're going to round it up and go on and say the pump setting would be 500 milliliters per hour on the pump, and we would be good to go. Alright, so we gave you a lot of good practice here. We'll do some more, and we'll have some up on a worksheet pretty soon. And this is what we call simple concentration. So let me make sure we know what we've done here. We've learned how to convert units from milligrams to micrograms and to grams and etc. We've learned how to convert weight. If you'll remember, every 1 kilogram equals 2.2 pounds. We talked about how to convert it. We talked about how to figure up total drug, total amount, based off weight. If you remember, that's where you take the patient's weight in kilograms and you multiply it times the amount they want you to give. We then talked about fluid calculations. And then today we talked about simple concentration. Now, if you are having trouble or you do not remember any of these things, you need to go back and watch the video. And if you can't figure it out with the video or figure it out using your book, then you need to come see me and make sure that we get this covered, because we've got 2 more major steps, 2 more steps to come. And they are the most important factors. We've got to figure out the ones to come will be the actual drug calculation, which is how do I know how much to pull up in the vial or in the syringe. And then the last one is a weight-based infusion. So these are the two major steps to come, and then you will have all of the drug calculation information you need. So I'm excited about that, and we'll go to the next video whenever you're ready, and we'll see if we can't finish up our pharmacology stuff.